Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Although COVID-19 generally results in less severe illness among children and adolescents, they can still get the virus that causes COVID-19 and spread it to others, including those who are more vulnerable to serious illness and related complications. In the U.S., more than 13,000 children have been hospitalized, and more than 300 have died due to COVID-19 since the start of the pandemic. On May 12, 2021, the Advisory Committee on Immunization Practices recommended that the Pfizer COVID-19 vaccine be used in adolescents aged 12 to 15 years. CDC also provided new guidance on co-administration, which now allows COVID-19 vaccines to be given at the same time as other recommended vaccines, including influenza. With me today is NFID Medical Director, Dr. William Schaffner, to talk about these exciting new developments and what it all means for our efforts to stop the spread of COVID-19. Bill, as always, it's a pleasure having you.
Good to be with you, Marla. And as we say with COVID, the only constant is change, and we've had some good changes just recently.
Indeed. So, Bill, what is the significance of the new recommendation for vaccination of 12 to 15-year-olds, and what were the reasons for the change?
Well, the reasons were pretty straightforward. All the manufacturers, Pfizer got there first, are doing studies working their way down the age ladder. You know, we have recommendations starting at age 16 now and older to be vaccinated, and the manufacturers did studies from age 12 through age 15 and discovered that the side effects associated with the vaccines were really quite comparable as those occurring in older adolescents and young adults. And the effectiveness of the vaccine was, if anything, if you can believe it, even better. There were no cases of hospitalization or serious COVID in the vaccinated children. And so the Food and Drug Administration gave an emergency use authorization for the use of this Pfizer vaccine starting at age 12 now, and the CDC's Advisory Committee on Immunization Practices reviewed all of those data very, very critically, and then unanimously voted to approve the use of this vaccine. I should say, recommend this use of vaccine in all children starting at age 12. So that's really good news.
Indeed. I think that leads, though, to the question, are we now likely to start seeing schools requiring COVID-19 vaccination for students?
Well, let's step back a moment and distinguish a recommendation for the use of this vaccine from a requirement or a mandate. I know of no public school system or any state that is going to put in mandates, requirements for the use of this vaccine going forward. Now, that said, that's the public school system. There may well be private schools, grade schools and high schools, that have that requirement for their students. And actually, among colleges and universities, as of last week, there were at least 100 of those institutions that had said students coming back in the fall will be required to be vaccinated. But in the public school system, that won't happen.
Thank you. So shifting gears a little bit, Bill, what should our listeners know about this new guidance on co-administration of the COVID vaccines with other recommended vaccines, including flu this fall?
Well, as we may remember, it was initially recommended when we started to use COVID vaccine that another vaccine not be given either 2 weeks before or 2 weeks after getting COVID. And the reason for that was really pretty simple. We were starting to use COVID vaccine in the general population, and we wanted to focus on what the side effects were related to COVID vaccine, and we didn't want to clutter that up with giving other vaccines at the same time. Well, now we've given 150 million doses of this vaccine. We are very clear about what the side effects are. And since other vaccines can be given simultaneously, the CDC's Advisory Committee on Immunization Practices said, okay, going forward, we can give more than one vaccine simultaneously. We can give COVID and we can give another vaccine if it's indicated. And of course, it will be indicated fairly frequently. During the COVID era, we stayed away from medical care. Vaccinations diminished routinely in children and adults, and now we're trying to catch up with those other vaccines. And of course, there'll be the usual routine vaccinations that have to be given, and this will make it easier if they can be administered simultaneously. And as you mentioned, Marla, this fall we'll be vaccinating against flu, and there may be occasions where people come in, children and adults, who are eligible for both COVID and influenza vaccine. They can be given one in one arm and one in the other. It makes it much easier for us to catch up with our appropriate immunizations if we can give them at the same time. And we've been given the green light about that now by the CDC's advisory committee.
Good news indeed for minimizing trips to the physician's office. Bill, what advice do you have for parents who are now weighing whether or not to get their teens vaccinated against COVID-19?
Well, you can hear from my voice that I'm very enthusiastic about that. My grandchildren have been vaccinated already. Let's think about this. We all know that children, when they're infected with the COVID virus, are less apt to get seriously ill than are older adults, the folks with gray hair. We know that. But they don't get off scot-free, I'm afraid. There have been 1.5 million cases of COVID that have occurred in children. And as you said before, 13,000 at least have been hospitalized and 300 children have died of COVID infection. So that alone is a reason to vaccinate your children. In addition, the CDC told us recently that COVID is now been recorded as one of the top causes of death in children and adolescents. That's very serious. And beyond those issues, children can be spreaders, and nobody wants to spread this infection to someone else who will become seriously ill. And then lastly, opening schools this fall. The more children vaccinated, the safer it will be for everyone.
Certainly compelling advice. So I guess that leads then right into the next question is, when can we expect to see these COVID-19 vaccines available for children younger than 12?
One thing at a time. We're working down our age range, and the manufacturers are actually looking at grade school children and even preschoolers. You know, they're smaller and they're having to adjust the dose to make sure that the side effects are minimal while we get the maximum protection. Those studies are underway. Parents are volunteering their children for those studies as we speak, and we expect the results later in the fall and early in the winter. So stay tuned.
Sounds like a wonderful topic for a future episode. Bill, before we sign off, is there anything else you'd like to add for closing notes for the listeners?
Well, Marla, I'm thinking that one of the most frequently asked questions that I've heard recently are concerns expressed by parents about long-term adverse events associated with vaccines. And by long-term, they don't mean just months later, but 2 years, 5 years, 10 years down the road. Now, that's a perfectly normal question to ask, but I must admit, it has all the vaccine people, such as myself, scratching our heads. So why is that? Well, it's because with all the vaccines that we give to children and adults, none of them have those kinds of long-term adverse events. The adverse events that occur become manifest within 2 to 3 months after getting the vaccine. And we've had oodles of experience now with COVID vaccine. So that's an issue that I counsel parents they can put aside. That's one they don't have to be concerned about. But the answer is yes, we should, per the CDC's recommendation, get our children vaccinated. As I've said, my grandchildren have already received the vaccine.
And my children as well. So, Bill, thanks again for your valuable insights as always. We will certainly look forward to seeing how things continue to develop and look forward to discussing on a future episode of the Schaffner Report. Thanks, Bill.
Always a pleasure, Marla.